cases. So I want to turn to this somewhat more complex question that we got in advance of the live. And I think maybe Jenn might be best positioned to answer this one. So we were linked to an article from the Daily Mail about mutations in COVID-19, genetic mutations in the virus, saying that there are 3 different strains out there. And the question is, if this article is accurate, that there are 3 different genetic strains out there already, or maybe more. There was another article that suggested there are actually 8 or maybe even more strains. Is it possible or likely that the virus will mutate more times before there's a vaccine? And how does that affect what we know about the virus and about vaccine development? Jenn, is that in your wheelhouse?
No, I'm happy to give it
okay.
Give it a go, but I should say that I guess none of us are virologists officially, so we're kind of
I was thinking
unofficially.
or unofficially, right? I was thinking more from a population health perspective, and I can actually come back and talk a little bit about what I know about vaccine development, although I am also not a virologist. So
yeah, no, so we're kind of doing our best to read the scientific papers underlying these news articles and interpret them based on our broader expertise. And so, but this is a great question because we have seen the similar things, and I think the good news is that in general, these coronaviruses seem to mutate much slower than flu viruses, which probably a virologist could explain, but something about there's not as many surface areas to change over time. So while there will be some drift, I think conceptually we're much more hopeful that a vaccine that would at least be stable for 1 or 2 years is more realistic. So I think the genetic drift that's happening now is helping us to track kind of geographically the spread, because these are very slight changes, but I don't think they've changed the character of the virus into completely new strains yet. So I think we do think that it's going to be a little bit better of a picture than flu as far as length of immunity, possibly 1 to 2 years based on other coronaviruses. And that should be enough for us to have a good vaccine target that won't change too quickly. But I'd love to hear Malia's thoughts on that.
So that's similar to my understanding from what I've heard from people who are virologists. There are degrees and types of genetic drift, and the kind of genetic drift that we're seeing with SARS-CoV-2 is not the same as what we see with flu, where it makes it hard to develop a universal vaccine. And so we still are hopeful that the universal vaccine is going to be possible, even though we are seeing some of this genetic drift. But as Jenn said, I think it's really interesting that we can use that kind of genetic drift to date the spread of the epidemic over time and space. And so one of the things that we've learned from studying those genetic changes in the virus itself is that most of the cases that were introduced into the United States, especially on the East Coast, actually came from Europe and not from the origin point in Asia. So they were people who were, so the virus didn't jump directly from China or other points in Asia to the United States, but it probably came in mostly from Europe. So interesting